Okay, let's have a look at yet another letter. This time it's a discharge letter, it seems. Let's have a look at the task. So what have we got here? So now the notes, I think this is from the Kaplan book. It's a practice test. Seems to be a discharge letter. So let's see what we have to do first. Discharge to skilled nursing facility. Okay. Doesn't really tell me what the task is, but I assume it's a discharge. So let's have a look. Mr Jacob McCarthy, 82. Right below knee, amputation, diabetes, dementia. Oh dear, that doesn't sound good. Vascular disease, osteoarthritis. Oh, not a well man, it seems. So, social background, the wife's a primary carer. Okay, that's going to be, could be useful because it's discharged to a nursing facility. Long history of non-compliance. All right. Surgery performed, all biotics, wound is clean, needs assistance with daily living, wheelchair. Monitor the wound, okay, check for infection, assist with ADLs, change the dressing. Okay, okay, that seems pretty straightforward. So let's have a look, see what we've got here. So first things first, as always, 216, that's pretty good, yeah. What you can do if you're concerned about you word count, and this is advice I'm sure you will have seen before. When you are practicing your writing on lined paper, you know how many words you usually write on a line. Is it 8 or 10? Then you can calculate how many lines is going to be round about 200 or thereabouts. Okay, so it's not too hard. It's just a little thing that you can do. So let's have a look. Put the changes on. Mr. Jacob, aged 82 years. Well, or aged. You don't have to put years. Just put age 82 and aged. I just say age. He aged 82, age 82. Very good. Writing to refer Mr. McCarthy back into your care. Back into your care. Was he there before? Don't know. Don't think so. So, discharge back into your care. He was being discharged today after a right below knee amputation for diabetic ulcer. So the amputation was for a diabetic ulcer, or it was caused by a diabetic ulcer. You need to be clear. Let's have a look. Diabetic ulcer, diabetic foot wound. Okay. It's good to keep checking the notes. Okay, that isn't bad. Mr. McCarthy came with 2-week history of fever chills associated with non-weight bearing right foot. Associated with his non-weight bearing right foot, or a non-weight bearing right foot in general. A systematic examination of signs of diabetic neuropathy, which was supposed to be. Supposed by whom? Meant to be? I don't know. I don't know if we would use that. Which was associated with. I don't know about supposed to be. Have a look. Is anything about supposedly? So, which was associated, or yeah, get rid of that, which was associated with his long-term non-adherence to diabetic medications. Hence, after positive blood cultures, he was planned. I don't know if you can use he was planned in passive. He was planned, or he was scheduled, or a right below knee amputation was planned. I think that is better, because saying he was planned, that doesn't work. So a right below knee amputation has about the blood cultures. Okay, that is better in terms of word order. A right below knee amputation was planned. Subsequently, he underwent surgery successfully in the post-operatively due to his disability. With a wheelchair to help him. Okay, yeah. Mobilizing, I don't know, mobilization I think is better. Make it a noun, not a verb. Mobilization. Or mobility might be better, but you've used, we've already got that word there. So due to his limited mobility, he was provided with a wheelchair to help in mobilization. Okay. His post has progressed good, has progressed well. Don't use good, that doesn't sound good. His post-operative status has progressed well, apart from severely reduced mobility. I shouldn't laugh, but you know, if you cut off somebody's leg, the mobility possibly might be affected. So, do we really need to include this? Sorry, I shouldn't laugh, but after we amputated his leg, his mobility was seriously impaired. Really? Was it, doctor? Okay, thanks. Thought what's good news results. Additional medication with antibiotics and painkillers due for 2 weeks. His wife wants him back, and he's going to the care of a skilled nursing facility and physiotherapy. Now, that isn't bad. Not bad at all. You see, I don't need to make a lot of changes in this letter at all. So it's just, we don't really need, it's just 1 or 2 things that we can omit. But in general terms, this is good. But obviously, the more errors we can eliminate, the higher the score will be. So refer Mr. McCarthy into your care, because he hasn't been there yet, so he can't go back. Put an article, put a pronoun. That use of passive wasn't so good. Mobilization progressed well, yes, and put an article there. So excellent, that is not bad at all.